Hello everyone. Cell, the functional unit of life. Cell, its function always amazes us. And the cell death is even more interesting. We have heard about necrosis, we have heard about apoptosis, we have heard about necroptosis, a combination of both necrosis and apoptosis. We also have heard about ferroptosis, which basically is a inflammation and apoptosis. Welcome to today's lecture on which I will talk about another new form that is called as ferroptosis. Yes, you heard it correct. Ferroptosis, something which is new, and how a cell will actually face a ferroptosis, what are the basic mechanisms of ferroptosis, and what is the clinical importance. So in this video, I'll talk about all these features and tell you what and how ferroptosis, a new form of cell death, and is now coming up, right? So what exactly is ferroptosis? Let's understand this process. To make it simple for you, let me just give you a basic understanding of what exactly is this term called as ferroptosis. The term ferroptosis, if you look at this word, you'll get to know that this basically is a cell death, but the cell death has a ferrop. That means it's actually a iron. It's actually is an iron dependent pathway of cell death. The basic thing that you must understand is, yes, it is iron induced cell death, but what is the basic mechanism? By lipid peroxidation. Now, when you understand lipid peroxidation, you will understand, yes, it will lead to the cell membrane or plasma membrane damage. So basically what happens, remember this, excessive intracellular iron, I'm writing it just as Fe. This induces a lot number of reactive oxygen species called as ROS. So iron will induce the reactive oxygen species and will exhaust all the glutathione induced antioxidant mechanism, which you remember we have read this as GSSG or GSH. So this will exhaust the glutathione. This is very, very important. Glutathione antioxidant mechanisms. Okay, so please understand few important things about this cell death. It is talking about iron inducing reactive oxygen species, and this is depleting all the glutathione. It is exhausting or depleting, and this leads to a cell lipid peroxidation and eventually cell death. It causes unchecked lipid peroxidation. And this lipid peroxidation, guys, causes membrane dysfunction. It causes membrane. Which membrane? Yes, the plasma membrane. The plasma membrane dysfunction, including the lipid and protein interaction, the ion transport, the fluidity, everything is affected. And this causes complete loss of membrane permeability, and this leads to a cell death looking like necrosis. Okay, looking like necrosis. And actually you simply know that whenever you talk about the reactive oxygen species, you'll always understand it is always about a necrosis. Okay, so let's understand what brings upon this unique mechanism. Please understand, the cell death is like necrosis. The reason is increased iron inducing reactive oxygen species. We must also understand before we understand the mechanisms, yes, what are the electron microscopy findings, EM findings in the ferroptosis. Basically, it causes all the mitochondrial damage. It leads to loss of mitochondrial crystal. It leads to the outer membrane of the mitochondrial rupture. Okay, mitochondrial outer membrane rupture. It may lead to increased mitochondrial amorphous densities, which actually, if you remember, these all are the finding of irreversible injuries. But let's understand what is the basic mechanism of this unique cell death. What is the basic mechanism and whether this has any clinical implication or not. So when we get something new, we are mostly worried, or we are mostly thinking about what is the basic, actual finding or the clinical importance that any of this cell death can have. Let's first understand the basic mechanism of cell death. It's very, very interesting. It's very interesting. Think what happens. Let's assume this is a cell. Okay, this is actually a cell. Okay, and just to make it a double membrane so that it looks like a plasma membrane, I'm just making a double membrane, which actually is denoting a plasma membrane of the cell. Okay, now see, there are some transporters which help the cysteine molecule to basically enter inside, and which also help the glutathione molecule to exit outside. So this type of transporter which allows the cysteine amino acid to enter inside. Okay, cysteine amino acid to enter inside. Why? Because cysteine, if you remember, this is the one will basically convert to glutathione, so GSH. Now this transporter is often called as the SLC 3A2. Okay, SLC 3A2, and this also has one more SLC 7A1. Now what happens because of this unique mechanisms? While the GSH is being formed, the GSH, if you remember, it can transport to GSSG, that is the oxidized form by a unique enzyme called as glutathione peroxidase. The GPX, I'm writing as a short form of glutathione peroxidase. Okay, peroxidase. So what is the unique mechanism? This GPX that I'm calling as glutathione peroxidase will convert the reduced form of glutathione, that is GSH, to the oxidized form called as GSSG. While because of it there is one more change that happens. There is one more change that happens because of this, and that is it also converts the peroxides, that is OOH, into alcohol OH. As you all remember, the OOH is actually a peroxide. Okay, this is peroxide, and this will convert to a alcohol, and this will prevent the free radical injury. However, sometimes what happens, there is a inhibition of so-called SLC by some drugs. I'll talk about that, and that decreases cysteine, that decreases GSH, or there are some drugs which can inhibit the GPX also. There can some drug which can inhibit GPX also. Now this increase in the OOH, this will cause the increase in the reactive oxygen species, and that will lead to ferroptosis. This increase in the OOH, this is the one which leads to ferroptosis because of very high free radical species. Also, the same thing can also be done by, there are some more receptors here which is actually directly inducing the iron, like the transferrin receptors. So if I draw this transferrin receptor in a different way, this is how a transferrin receptor will look like. This is how this actually is a transferrin receptor. Obviously you all will remember that transferrin receptors allow the Fe3 plus to enter the cell. The Fe3 plus enters the cell. Now this, with the help of a steep molecule STEAP, it will change to Fe2 plus molecule. So now you see the iron has increased in the cell. This increase in iron increases reactive oxygen species, which can also lead to ferroptosis. This can also lead to the ferroptosis. Remember guys, not only this, there's also one more mechanism which can lead to ferroptosis in a cell, and that is a PUFA, polyunsaturated fatty acid. So remember, there's one more mechanism that is called as PUFA. In this PUFA mechanism, this PUFA, the PUFA often will convert, to the I'll say a phosphatidyl ethylamine, that is an oxidized form of PUFA. It is called as PUFA PE, and this increase in the PUFA can also lead to ferroptosis. So what is happening? Ultimately, you see, all these three are eventually causing ferroptosis, which is increase in the iron. Now we must understand, how are we correlating this? See, and what are the clinical implications? There are some I'll say enzymes which converts the PUFA into the phosphatidyl ethylamine, that is called as PUFA PE, and that is there's some enzymes acting here, and this enzyme is LPCAT3. Now let's understand what are the basic reasons when the when this thing, that is ferroptosis, will increase. One of them can be a inhibition, one of them can be a direct inhibition of this receptor here, this one. So if some drug is able to inhibit this, it will increase the ferroptosis. Some drugs like elastin, this is a chemo drug, it's a chemotherapy drug, it is helpful in treatment of some cancers. Along with this sulfasalazine, okay, so this will inhibit the SLC7A1, and this will decrease the cysteine. Decrease in cysteine will decrease GSH and will again cause increase in the reactive oxygen species, will causing the ferroptosis. One more way is to inhibit the GPX. The GPX can be inhibited or the GPX can be destroyed. Okay, the GPX inhibition is by a unique, it's a drug called as RSL3. Again, these are new things, and everything new is important, right? This RSL3 is RAS selectable lethal marker. It is RAS selective lethal small molecule 3. So yes, it's a bit confusing, but that is what the RSL3 stands for. Can also be inhibited by this GPX can also be inhibited by a different drug called as FIN56, and this LCAT, this can be inhibited by, this can be inhibited by the vitamin E or the ferrostatin, vitamin E and ferrostatin. This can inhibit LPCAT3. The entry of this iron can be inhibited by deferoxamine, so DFO. It can be inhibited by deferoxamine. So my question now is, once you have understood these few things, can we just simply can we simply have that courage to say which of these mechanisms will increase ferroptosis? Which of them can increase ferroptosis? Obviously, see, among them, which of them will increase ferroptosis? So obviously, elastin, sulfasalazine will increase it. Inhibition of RAS and the FIN3, this will increase ferroptosis. But if you see, if you are able to inhibit this LPCAT3, this will decrease the PUFA EPE, and that will actually decrease ferroptosis. So this will decrease ferroptosis, and also deferoxamine will also decrease ferroptosis. Now, what is the clinical implication? Does it have any clinical implication? Please understand, whenever there is increase in iron in a cell, it can lead to a cell death, by ferroptosis. There is a precise mechanism why sometimes in inflammation you are never giving iron to a patient. So if a patient has inflammation going on, or you want to decrease inflammation, you'll always decrease the iron in the patient, because when you give decreased iron to the patient, the chances of ferroptosis decreases, the chances of cell death actually also decreases. Now I'll tell you what are the diseases in which ferroptosis has been shown to have a very important role to play. So a recent article from the Cell gives you some diseases which you must know. So this was published by Lee et al. In this Nature's article of 2020, from which we have just taken out this. So this is a ferroptosis, and various diseases in which ferroptosis has a role to play are some nervous system disorders like neurodegenerative disease like Parkinson's, amyotrophic lateral sclerosis. There is Huntington's disease. There is Alzheimer's disease, and apart from this, as you see there, there's a stroke. There's traumatic brain injuries. Okay, in pancreas, there's pancreatic cancer, type 1 diabetes. In kidney, there's AKI, ischemia, reperfusion injury, clear RCC. There's lot number of tumors. There is adrenal carcinoma, there is lung cancer, there is GI cancer, there is liver diseases, including liver cancers. There is heart may, there is ischemia, reperfusion injury. So all of this disease has been linked to increase in the iron. So now we have got to know, why does increase in iron causes the problem? The reason is the increase in iron increases reactive oxygen species, and that ROS increasing can cause cell death by ferroptosis. Well, when you know this, Can we go a step ahead? Yes, you can. You can go a step ahead by stating that if you are able to give this drugs, this drugs like vitamin E, vitamin E, ferrostatin, the deferoxamine should have a decreased effect on ferroptosis and therefore should have some therapeutic role to play, isn't it? So I'll just write here what are the drugs which can decrease ferroptosis as we know today. So drugs which decreases ferroptosis, remember this, are the vitamin E, and as you know it has an antioxidant mechanism. Now you get to know how does it have a role to play. Vitamin E, there is the ferrostatin, and there is DFO, that is deferoxamine. So all of these three drugs are the recently approved, FDA approved drugs which have some role to play in decreasing all those various cluster of diseases which have important cell death by ferroptosis. Dixol was a scientist who actually coined this term ferroptosis, thinking there is increase in iron, there is cell death, let's combine the name, and hence he came with the idea ferroptosis. So what should you know? It's an iron dependent pathway of cell death due to lipid peroxidation. Because of lipid peroxidation, the plasma membrane gets damaged, that causes decrease in the permeability and eventually causing cell death by a mechanism morphologically looking like necrosis. I hope I was able to justify this topic, ferroptosis. Do share this video, like, comment and subscribe to my channel, and I'm very sure we'll go a long ahead and understanding various other upcoming things in the subject of medicine. Thank you, take care, and God bless you all.